Hi, I'm Dr. Tom Anderson, Stedman Hawkins Clinic of the Carolinas, and I want to speak today about postoperative care after foot and ankle surgery. A lot of discussions usually takes place about the surgery itself, and sometimes there's some questions about what will occur afterwards. There are some variabilities depending on what type of surgery someone is undergoing, but there are some key aspects to all of these surgeries that need to be discussed. Of course, one of the main things that we've talked about is to have a good diet, elevation of the limb, and if you're a smoker, try to stop prior to surgery. But after you come home from surgery, one of the main things for the first 48 to 72 hours is elevation. This consists of the limb that's been operated on being slightly above the heart. If able to, without pinning or anything else in the toes, if the toes are mobile, they should be wiggled to help increase your blood return to your circulation to try to prevent swelling. Unless told otherwise, leaving the dressing on is important. It's in a sterile environment, and we usually don't want that taken down until you're back into the clinic. Signs to look for would be increasing discomfort, drainage, a foul odor, and also swelling that seems to be out of the ordinary. Certainly there is some swelling associated with every surgery, but if it seems to be at a plateau and then gets worse, that is a sign that you need to contact your doctor's office. Antibiotics are a question that we're asked a lot. How long and should you be on antibiotics at surgery? Well, as a matter of fact, you are on antibiotics at the time of surgery. They're placed in your vein, and they'll circulate in your veins for some period of time. For the larger surgeries, about 24 hours or less of antibiotics are given, but for most it's just during the time of surgery. Okay. So what we want you to understand is that you have had the recommended amount of antibiotic for surgery, and too much is actually not helpful for your healing process. Weight-bearing status is another thing that you need to know for your surgery. It's best to understand this prior to the surgery and going into it. However, sometimes there may be some confusion with this, but prior to leaving the hospital, one needs to understand how much weight they can put on the limb that's had the surgery. Sometimes it'll be to the degree that you can put no weight on it, and other times you'll be able to put as much as you can tolerate. These are not arbitrarily decided. It depends on what type of surgery you've had and how the limb will respond to this. So please make certain that you understand that and are able to abide by that weight restriction on the limb. After surgery, it's very important to have the proper water and protein intake to allow the body to heal. So overall, the things that need to be known are, if you're a smoker, try to stop, keep nutrition at a high point, understand about swelling and elevation, changes that are adverse that you need to contact your doctor for, and then the amount of weight you can put on the limb. Thank you very much.